You flush the toilet, before you flush that toilet, always look back. Your urine may be pointing out to certain health condition. It may be pointing out to some signs that will help you, protect you or help you report for early management and for better recovery. In this video, I'll be sharing 9 tips of changes in your or signs your urine may be showing you that can point to certain things, or when you can be feeling okay, everything is fine. Hello everyone, I am Nurse Miracle Udechi and I am a registered nurse, and in this channel I share contents on ways we can prevent certain diseases by little taking note of little signs that can point to a bigger disease if neglected. So in this video, I'll be pointing out to certain things about our urine that we need to take note of. Now, different ways our urine is presented. Sometimes you may urinate and you see that the color of your urine and the water is like you did not urinate, but you know you did urinate. It's so plain. Well, for it to be just plain colorless like that, it means you are overhydrated. That means you've taken so much water in a short span. I would advise that you reduce a little the quantity. Too much of anything is not good. So reduce the quantity of water intake so that you don't overwork your kidney. The next one is when your urinate is a pale color. You have this pale yellow color, like amber color, then that's normal. That's how your urine should be, a pale color, not too transparent or colorless. So in this one, then you are good to go. Just maintain your water intake and then everything is fine. Then the next is when your urine is very dark, deep yellow. You urinate and you can see it's very deep yellow, then you should know that you are either dehydrated, that you've not drank enough water. If you check from the time you woke up to that time, maybe the quantity of water is very small. So it means you should take more water to help your body filter wastes, your kidney filter waste properly. It could be that too that you've been exposed to very hot environment. So what, your body lose water in several ways, through urinating, through sweating. So when you're exposed to very hot environment, maybe you entered into an industrial kitchen where they are cooking and everywhere is steaming, there you'll be sweating a lot, your body will be perspiring and losing water that way. So then your urine may become dark. So what you just need to do at that moment is to get water and take. In one of my videos, I emphasize that water, the amount of water, everything should be balanced. You shouldn't take too much or too less. You need to watch that video because I cited an example and it pointed so much fact about water. And then the next thing about your urine is when you have a cloudy urine. A cloudy urine points to infection, but at the moment you would not be able to tell. So what you do is, if you notice it, just go to the hospital and your the medical team will direct you on what to do, so that if it's an infection, they begin to tackle it immediately. Because if you neglect it, it can cause bigger problems tomorrow. So the earlier the better. So then the next one is a foul and strong smelling urine. Some people that will use the toilet and the toilet will be smelling for a long period, and maybe unfortunately some of their urine dropped on the floor while urinating. If you don't mop that floor and maybe use an air freshener in the area, you will not be able to breathe passing that place, just passing the corridor of the toilet. So that strong smelling urine can also point to certain urinary tract infection that needed to be treated urgently. So if you notice that urine shouldn't smell so bad that everybody is wondering what's going on, shouldn't be like that. So that is it. Then the next one is if your urine is kind of red, a red urine. Now a red urine, now there are several factors, because I don't know if in Nigeria we have this drink they call is it Zobo drink? There's Zobo drink there that is from hibiscus flower. We have beetroot, if you know that fruit is also ready, and some certain things. So those things in a way can kind of enter into your urine and you begin to urinate that color of urine. But where it becomes a concern is when you didn't take those things and your urine are colored that way. That is, you didn't drink any of those drinks and yet you have that color. It could be that there is, a bleeding somewhere around your urinary tract that need to be treated and handled properly. So when you have a red urine. Now, a foamy urine is pointing to something. A foamy urine can point to the fact that there is an issue somewhere. A foamy urine, when there's a psychology, a medical science around foamy urine. When protein from the blood leaks through the kidney is supposed to filter waste, and protein is supposed to be returned back with the blood. But now there is a problem with the filtration, and now it leaks into the urine. Then it starts forming a foamy urine. Now, but let's get it clear so we don't get a misunderstanding. If you are urinating like with serious pressure, it may be bubbling, causing some foams, but that is not really what it means. Foamy urine is that after you urinate, just think about when you pour a wine in a cup that is foamy, and then you drop it. After a while, you see the foam take some time to drop. That foamy urine is like that. Not the one that bubbles and just disappears almost immediately. I mean, the toilet is filled with foam and it stays for some time. You know that there's a problem and you need to see the doctor, so that it could be a pointer to certain underlying diseases that, if arrested quickly, can help your health and help you improve better. So that is it. Then we have, last but not the least, a very dark brown urine. A very dark brown urine is simply pointing to a disease, and mostly a liver disease. A very dark brown urine. In some cases it can point to severe dehydration, but if it is attached to coloring, yellow coloring of the eyes, another, fatigue, person feeling weak and the rest, it can be pointing to a liver disease, and the person needs to visit the hospital for further checks, and then there will be treatments that can help the person recover. I remember sometimes someone who was very down, having to do with a patient who was down and on all these drugs to manage. I think he had tuberculosis, was being treated for tuberculosis and having to manage that. And then during that time, his urine was that dark brown. Maybe a combination of the antibiotics or the rest. But is either you are going through a treatment or due to drug interaction, then that will be on the lesser side. But if you just notice it's with yellow coloring of the eyes, it could be that there's a problem with the liver, the bile, and gallbladder and the rest. So the earlier it's managed, the better. I want to ask as a tip, are you experiencing frequent urination at night that it affects your sleep? You wake up by, let's say you sleep by 10, you wake up by 12, urinate, by 2, urinate, by 4. By the time you wake up so often like that, most times, if you are someone like me, that if you wake up like that, you lose sleep. To gather sleep is not easy. Then you now have to wake up so frequently. So if you are someone who goes through such struggles, it should not be neglected. But I would advise, before you begin to get to worry and say, what could be going wrong, first of all, check the time you drank water last and the amount you took. So if you took about 3 liters of water, in Nigeria we have this what they call pure water, and each pure water sachet is 0.5. That's half a liter of water. So let's say you took 3 or 4 sachets of that pure water before sleeping. By 10, maybe you took it around 8. So you won't be surprised that you have to wake up that often, because you've taken a large quantity in a short period. Do you get? So if you took a large quantity of water in a short period, then it can affect you and make you wake up frequently. But if not so, then it's necessary you see the doctor, so that they can review and check if their underlying condition, if it has any traces to diabetes. I'm not saying it's diabetes at first until it is confirmed, but it's necessary you go, because believe me, it's not comfortable waking up. Some even wake up so more frequent than I even mentioned. They wake up 5 to 6 times before daybreak. That's a whole lot, and that's tiring. Thank you so much. Enjoy what you watched, and you love to, please drop on the comments some topics you would like us to treat and also to express and explain further on. And this channel, we are promising to give you vital and prove, facts on your health that can help you better. Thank you.